Today, we will learn about pediatric airway in brief and various differences from the adult airway. So here we have two figures showing normal lateral neck radiograph, the first without labels and second with the labels. So we can see the various structures as this is mandible, this here is the oral cavity, this is the hard palate and soft palate, this is the nasal cavity, and behind the nasal cavity we have this region is the nasopharynx region, this is the oropharynx, this here is the hypopharynx or laryngopharynx, which anterior to which lies the larynx. This is the larynx. This is the subglottic trachea. Here we can see this projection. This is the epiglottis. This is the epiglottis. And anterior to epiglottis, here we can see the hyoid bone. Also, we can see the mid-sagittal neck section in the CT in this third figure. Here we can see the part of brain. This is the sphenoid sinus. This is the nasal cavity, hard palate, soft palate. From the base of skull to the soft palate, this behind the nasal cavity, this region is the nasopharynx. And below the soft palate to the level of hyoid bone, we have oropharynx, and oropharynx communicates with this region, which is hypopharynx or the laryngopharynx, which includes piriform sinus, posterior pharyngeal wall, and postcricoid region. And this is the laryngeal inlet, and this here with the various shades of green we can see supraglottic larynx, glottic larynx, and subglottic larynx. In this figure, figure 4, we can see the various sites of pathology in the lateral neck radiograph. So here we can see if the prevertebral soft tissue, this space is increased in conditions such as retropharyngeal abscesses, and if these adenoids become hypertrophy, we can see increased radio density in this region, which is adenoid tonsils or adenoidal hypertrophy. If this epiglottis is inflamed, we see in the epiglottitis as a thumbprint sign, and also we see croup, which is the involvement of this region, which is the upper airway, which gets inflamed in croup. So there are two important signs which are seen in this condition in epiglottitis and croup. Two important signs seen in the epiglottitis and croup. In epiglottitis, there is the inflammation of this epiglottis. So thumb-like projection is seen. Thumb-like radiodensity can be seen in the lateral neck radiograph, which is also known as thumbprint sign. And second sign is the Steeple sign or inverted V sign or wine bottle sign. Steeple is the church top which gets narrowed. So here croup is a viral condition in which causative organisms such as para-influenza, respiratory syncytial virus affects the upper airway. So it is also called as acute laryngotracheitis, involving the upper trachea and larynx, seen in the age group of 6 months to 15 years, but the mean age group is around 18 months. Here we can see there is tapering in this subglottic airway region, which resembles the church top, also giving the appearance of a stipple. So it is known as Steeple sign or inverted V sign or wine bottle sign. Now coming to the difference between the pediatric airway and adult airway. This is the schematic diagram showing the various structures. This here is the tongue drawn from the red color. Below this, from the blue color, it is representing the laryngeal airway in the child and adult. This here with the black color is the hard palate, this is the soft palate, this here is the tonsil, adenoids, and this is the nasal cavity. This is the thyroid cartilage, this is the cricoid cartilage. So coming to the various differences one by one, in the children, the tongue is larger in size out of proportion to the oral cavity size. Secondly, the adenoids, they are large in children. Also, the pharynx, it is small as compared to the adult pharynx. And very important difference is the epiglottis. In the pediatric airway, the epiglottis is omega shaped as seen in this figure, and it is long and narrow, giving a floppy epiglottis appearance as compared to the adult epiglottis, which is leaf shaped, firm, flat. Then the larynx is anterior and high as compared to the adult airway, which is larynx is more caudally placed. So glottis in the pediatric airway, it corresponds to C2 and C3 cervical vertebra. However, in the adult airway, it corresponds to the C4 and C5 vertebra. In pediatric airway, cricoid ring, which is below the glottis and subglottis, this cricoid ring is the narrowest part and giving a funnel shape to the airway. However, in adults, glottis or vocal cord is the narrowest part, so the shape of airway is more cylindrical or column shaped. Also, the trachea in the pediatric airway, it is small and short, less rigid trachea as compared to the wider and longer trachea seen in the adult airway.